All right, so moving on, we are talking about the GI tract here. Your overview, we're going to kind of go over. Again, we're not just going to talk about just strictly like the stomach and the intestines. We're also going to talk about accessory organs as well. So we're going to talk about things like the liver, the gallbladder, the pancreas. Kind of include all of that in one. And now, again, we're talking about like the pancreas here. We're not really talking about the endocrine functions so much as we're talking about the exocrine functions, right, and things like that. So again, this is where we're going to cover these good accessory organs. All right, so introducing the GI system. Have you guys covered this in anatomy yet? So you're very familiar. We're basically just big tubes. You have to think about it. This is why sometimes when talking about like drugs being used, like say in the colon, we talk about them being like a topical use, because again, technically your intestines are kind of like the outside is just kind of flipped inside out essentially, right? You ever seen like one of those toys that's like filled with fluid and you can like put your finger through it and it kind of goes over? Like that's basically what we are essentially, if you think about it in an abstract enough sort of manner there. That'll probably play pretty well for the recording. But again, this is good for one-way transport. Is it always one-way transport? Not always. Again, vomiting occurs, right? We like it to be one way, but not always going to be the case, right? But again, it's specialized for this transit from one end to the other, essentially. So again, going from the oral cavity, going to the pharynx, esophagus, stomach, small intestines, large intestines, finally the rectum, anal canal, and anus. So again, we'll go over the details of how all these are functioning with one another, but I'm not going to belabor the anatomy here so much. Again, obviously we have some accessory organs here, so the teeth, tongue, salivary glands. What are salivary glands good for? Yeah, breaking down amylase is the big enzyme there. It's going to start to break down carbohydrates. Good. Liver is going to be good for what? That's right. Everything basically is going to be hitting after it gets absorbed from the GI tract for the most part. It's going to be going through the liver, right? Just remember that first pass effect we talked about. Again, a lot of that blood flow is going to be going through the liver there. Gallbladder is good for what? Storing bile, and then once it excretes bile, what does that do? Yeah, it starts to emulsify fats. It allows fats to get broken down to smaller components that we can absorb, right? And the pancreas, what does that help us with? Amylase, bicarb, other isoproteases, things like that. So again, lipase. So we'll find there's lots of enzymes from the exocrine function of the pancreas are going to be really important for helping us to digest our food, right? So again, we need lots of enzymes for that. Pancreas is a big player there. Good. What is the bicarb used for? Good, yeah. So we're going to look at the changes in pH of the GI tract. We're going to see it goes from relatively neutral, as they like in the oral cavity, as it gets very acidic in the stomach. But we need some way to kind of neutralize that. So the bicarb there can be very useful. Again, we're going to detail on these as we go forward. Okay, so again, when we talk about actual movement of food throughout the tract, we talk about motility. So if you hear like promotility or anti-motility, that's basically what we're talking about, as things kind of moving through. So again, of course, ingestion is actually taking the food into the mouth. Mastication is just chewing, kind of mixing it with the saliva, getting it lubricated, ready to be swallowed. Deglutition is the actual swallowing process. And peristalsis, we mentioned, is just what? Yeah, kind of nice wavy patterns that kind of move things from one direction to another, hopefully preventing backflow of materials. And then we'll talk about segmentation, briefly. That's going to be, we actually have the churning and mixing that actually occurs there. And again, all of this is kind of regulated through smooth muscle contractions, right? So again, you're going to find that a lot of these organs are going to be kind of run with smooth muscle going in different directions that allow for either like forward movement or allow for churning and segmentation, all that kind of good stuff. So again, it all has to work kind of in tandem to make sure things are going in the right direction. So that way you don't have things kind of squeezing off at one end, preventing flow from the other, etc. Things like vomiting and all kinds of problems that can develop there. So looking at the actual gastrointestinal wall, typically you're going to see the serosa here. I think I misspelled it here. But you'll have things like longitudinal smooth muscle. Things like circular smooth muscle, and again, these are just muscle heading in different directions. They allow for different kind of mixing sort of patterns there. And then we'll focus more on things like the submucosa and the mucosa itself. And again, you're going to find that this is going to be good for, we're going to see a lot of like the different cells are going to be secreting products of the GI tract. We're going to see a lot of absorption happening through here. And again, because the GI tract typically have low surface area, high surface area. You have a pretty high surface area, especially when you get into the small intestine. So again, we want that because we want to have good absorption of all of our nutrients and things coming into the GI tract. Okay, so again, looking at the GI muscle itself, it should be functioning as a syncytium. And remember what that term means? These all work together, right? Just like the cardiac system has to work as a functional syncytium, going from the atria contracting to the ventricles, everything kind of all contracting at once. The GI tract has to do the same thing, right? So it needs to be working very well together. They'll even have similar gap junctions as what we saw within the heart to allow good flow of ions, to allow for flow of action potentials from one area to another, right? So that way you have nice kind of concerted sort of squeezes of the muscles, so that way everything kind of works in the right direction there, okay? Now, what you're going to find is the activity is going to be a little different in the GI tract based on different things. So again, the contractions are very different than what we see with, like, say, for instance, the heart, right? Heart is going to be kind of beating and relaxing. With the GI tract, they're going to see a much more kind of long, strong sort of contractions that can occur over a long period of time there. So you can see things like with slow waves. These are not really going to be action potentials necessarily, but you can see this kind of pacemaker-like activity. You can see the slow waves here. We're going to have this kind of undulation between various states. They can have spikes to it. It can have modifications to it. We actually have these big depolarizations that occur that actually allow for the actual contraction itself. These are the true action potentials, and these are going to be mediated just like we saw with the neurons. These are going to be mediated through sodium and calcium channels. Mainly sodium causes a big depolarization. Calcium flowing into the smooth muscle, it does what? Causes contraction, right? Again, calcium comes in, causes contraction, as you we'll go over smooth muscle function later on in the musculoskeletal system, later on in this class, but just know calcium is good for causing smooth muscle contraction. You notice because we don't need those really kind of quick squeezes of the muscle there, it needs kind of more kind of low and slow essentially. You're going to find that the sodium channels are going to be kind of slower to open and close. Again, GI tract is more of a marathon, not a race, so to speak, right? Sometimes it feels like a race, especially after like maybe some like you go to your favorite Mexican food restaurant or something like that. Just depends. But again, it should be kind of more of a marathon, right? So you can have longer, stronger contractions, the kind of tonic contractions you'll see there. And what's interesting is you can modify the resting membrane potential, right? So again, resting membrane potential is where the cells are kind of at baseline. And so, for instance, if I were to make it more positive, what would you expect to see? See more or fewer action potentials? You'd expect to see more, right? Because again, the cell's more positive. I'm closer to that threshold of actually having a depolarization there, right? On the other hand, if I were to say hyperpolarize it, what would you expect to see? So make it more negative, making it more difficult to have an action potential. Okay. So for instance, when is a situation where I want the GI tract to maybe I don't need so many action potentials? Well, if I'm digesting food, I probably want to have action potentials. I want to have those squeeze of the muscles there, right? So what instances do I not really care about the GI tract functioning so well? Usually fight or flight responses, right? So think about the sympathetic nervous system is going to have a big role to play here. So for instance, if you're looking at stimulation by norepinephrine, epinephrine, things like that, you should expect to see things like hyperpolarization, because when I'm in a fight or flight response, do I care about digesting that meal I just ate? No, I need to actually run away so that I can later on digest if I survive, right? On the other hand, if I were to have something like a parasympathetic, that would actually cause more depolarization of the cell. The resting membrane potential should go up. You're going to see more positive, more likely those contractions, because again, that's the rest and digest system there, right? So again, we're talking about the different effects here with the sympathetic versus parasympathetic and how they'll have either stimulatory or inhibitory uses as we go forward. Okay, so looking at the enteric nervous system, this is actually very, very extensive sort of nervous system all the way throughout the GI tract. We're going to go all the details here, but again, it's nearly as complex as your CNS as far from a neuron number standpoint. And again, so if anyone ever calls you a smartass, you can say, well, that's actually true. Anyway. Again, it's going to be going all the way from the esophagus to the anus, and again, nearly equal to the number of neurons in the spinal cord. So again, very, very extensively innervated here. You're going to find there's kind of an outer and an inner sort of plexus here. Again, this is all going to be really important. They're communicating well together and also centrally as well. So you're going to find there's also going to be these efferent sort of signals that will be sent up to the CNS. Because again, when you're about to eat a meal, what kind of happens when you have like a big like juicy steak coming out at you, or I guess a big juicy piece of broccoli if you're a vegetarian coming out at you? What is sort of the effects that occur? Start to salivate, right? So again, as your GI tract hasn't come into contact with anything yet, the CNS is working with everything there. So we'll look at the details there on how it's going to be working. But basically, you're going to have things like the outer enteric plexus here, this Auerbach's plexus, which is going to be good for kind of controlling overall GI movements. Again, it should be going in one direction for the most part. And then you're going to have things like this submucosal plexus or this Meissner's plexus. This is good for kind of maintaining things like GI secretion and blood flow, right? So again, if I'm in a more like digestive sort of standpoint, just eat a big meal, you'd expect again both of these to be kind of increase in activation, should be causing movement, it should be causing increase in secretion of all sorts of different substances. And again, typically when I'm having digestion occur, do I want blood flow to increase at the GI tract or decrease? Typically increase, right? So again, that's why, for instance, if I were to, like your mom ever tell you when you're growing up is like, after you eat lunch, you want to go jump back on the pool, so you got to wait 30 minutes, otherwise you're going to what? You're going to cramp up. Why are you going to cramp? Because if I'm exercising, jumping into a pool, like all that blood flow is trying to go to my skeletal muscle, the GI tract is going to take a bit of a hit there, and you have all that food just kind of sitting there, just not really being absorbed, and you're going to start to see some cramping there, right? So again, sometimes your mom is right when she tells you things growing up. You may not think otherwise, but I did it anyway too, so I don't feel bad if you just jumped in the pool. But So again, you're also going to find these afferent sensory fibers. So again, these are going to be originating in the GI epithelium, and these are going to be eliciting sort of local reflexes as well. So again, there's a lot of kind of local communication that occurs between different smaller sections of the GI tract to allow for that kind of coordinated movement from one direction to another. Okay, so looking at autonomic control here, again, what nerve is going to be good for with our parasympathetic innervation? Vagus nerve, and number 10 is going to be good for parasympathetic innervation here. Again, you're going to find it's going to be stimulating kind of all areas of the GI tract, as you're going to see. You're also going to have the pelvic splanchnic nerves that are going to be good for controlling kind of the lower large intestine, as you'll see. But again, the vagus nerve is going to be good for kind of controlling everything kind of from top down, essentially. So really, the most lower portions are going to be more on the sacral spinal cord there. Now, again, the parasympathetic nervous system is mainly going to be releasing what? Acetylcholine onto muscarinic receptors, good, and generally should do what to the GI tract? Increase activity. Should expect, think parasympathetic nervous system, think increase in GI activity. Remember we talked about the mnemonic we used to remember parasympathetic activity? Dumbbells, right? What was the E? Emesis, right? So again, stimulating the GI tract. What was the D? Defecation. You want to go through that again real quick? Remember D? Defecation, U, urination, M, mydriasis or meiosis? Meiosis, good. B, what does it do to the heart? Bradycardia, what does it do to the lungs? Bronchoconstriction, also bronchoria. You're going to see fluids develop in the lungs there, right? What's the E? Emesis, right? So again, stimulating the GI tract. L, lacrimation, good. So you're going to be tearing up. And then S, salivation, right? So again, typically the parasympathetic nervous system is activating the GI tract. It should be increasing things like secretions and peristalsis and all that. So you're going to see diarrhea, you're going to see salivation, all that sort of thing. So again, parasympathetic, think increasing GI activity. Okay. Okay, looking at the sympathetic division there, you're going to find that this typically is going to try to inhibit peristalsis and try to inhibit secretions coming from the GI tract. You may find that it can actually excite some of the mucosal muscle, but generally it's going to be decreasing activity here. Okay, it's also going to stimulate contraction of some of the sphincters, right? So again, by contracting sphincters from one area of the GI tract to another, what does that do? It impedes flow, right? So again, just like if I were to contract the lower esophageal sphincter, that prevents food from going where to where? Esophagus to the stomach. Good. So it goes back to your anatomy stuff. Now again, with the sympathetic nervous system, what's the main neurotransmitter we're focused on? Norepinephrine, right? And it's going to be acting on what type of receptors? Alpha and beta receptors typically, right? So again, think alpha typically going to be like more constrictive. So if you think like constricting a sphincter, just like we were looking at that internal urethral sphincter when we're talking about micturition, you're going to find that that's going to cause constriction there. In some cases, you may find actual relaxation through the beta receptors, right? So you can think back to that. Okay, so it's kind of three main reflexes that are kind of essential to GI control here. So I'm going to go over each of these as we go forward. So again, one are going to be these reflexes that integrate within the gut wall enteric nervous systems, right? These actually don't communicate with the CNS at all, but it's going to be good because this is going to help to control the secretion. It's going to help to control peristalsis, kind of mixing contractions, some local inhibitory effects. This is good because basically it's going to cause this peristaltic reflex, so this law of the gut essentially. Anyone ever heard of the law of the gut? So essentially, when I have distension or you know, have say a food bolus or something in one part of the gut, it's going to happen. What do you think happens to the muscle before that? It wants to constrict, because again, by constricting, it's going to force that food forward. The muscle after that food bolus, so this area of distension, does what? Should relax, right? So again, by doing that, you want to have that concerted effect where having kind of increasing squeezes, kind of forcing things along, while the muscle kind of going afterwards is going to be relaxing to allow that food to pass along. Okay, that's kind of that peristaltic reflex. That is what is being maintained with just this kind of integrated reflex with just the enteric wall itself. Okay, so it doesn't communicate with the brain. Your brain doesn't have any control over sending things through that particular mechanism, that particular reflex. Okay. Next, you're going to have the reflexes going from the gut to the paravertebral sympathetic ganglia back to the GI tract. Okay, these are good for communicating kind of long distances. This one right up here is going over short distances, really just kind of from inch to inch along the GI tract. However, when you have some of these longer distance travels, this is good because you can do things like signaling from the stomach down to the colon, right, to initiate defecation, right. So for instance, if I have like a big meal, I have a big breakfast. Where does that usually stimulate? I have to go to the bathroom afterwards, right? So again, it's one of those things where having the stomach starting to distend out says, hey, we got a whole bunch of food coming in, we got to make room for it. Let's go ahead and try to evacuate whatever we have in the in the colon and get rid of it, right? So that's one of the things you can find there. It's going to be better for kind of long-term or long-distance sort of transmission between different areas of the GI tract rather than just within the kind of local areas there. Okay, so that's one. And then the final one's going to be kind of going from the gut to the spinal cord, on the brainstem, and then back to the GI tract. Okay, so again, this is where you have signals being sent from the vagus nerve. This helps to control, again, kind of overall gastrointestinal function. Secretory activity typically is going to be increasing in activity for the most part. Do you have any kind of pain reflexes that may be able to inhibit the entire GI tract, which is why this is one of the big things we see, especially with surgery. Post-op, you see a lot of post-op ileus that happens, the GI tract, due to all either the drugs you're giving them or the pain inflicted with that. You're going to find that can inhibit the GI tract. So ileus is a big issue there. And then also we're going to find that you have like things like defecation reflexes. Again, when you defecate, a lot of muscles are getting coordinated there all at the same time. And so again, this is going to be important for those communicating up with the CNS essentially. Okay, so again, there's kind of local effects right within kind of local areas to one another. There's going to be some effects that go up to the sympathetic ganglia, back down to other portions of the GI tract, and then now you have like kind of the longest distance sort of travel going all the way to the CNS back to the GI tract. Make sense? So there's also going to be a lot of hormonal control of the GI tract as well. And we're going to go over all of these in more detail as we go forward. This is a good table to kind of go back and reflect on when you're kind of studying up and kind of learning like, okay, what are these different hormones? What do they do? Some are going to be inhibitory to certain areas. Some are going to be excitatory to other areas, as we're going to see. And typically, again, they're all kind of working in concert with one another. So for instance, we're going to see things like, gastrin being a big hormone, especially within the stomach. You're going to find that they have certain things that are going to increase its secretion. So those are good things to know. So for instance, if I have like a high protein meal, this can increase gastrin release. Good to know where it's going to be acting at within the GI tract. And it's good to know what it's going to be stimulating. So in this case here, gastrin, if I were to have, say, like a high protein meal, is going to be stimulating gastric acid secretion from these G cells. Okay. We're going to be looking at this in more detail, but again, this is a good table to kind of go back to and kind of reference when you're studying. Okay. Okay. So again, looking at the actual GI blood flow, again, it's going to be this splenic circulation is going to be including the gut, spleen, pancreas, and liver. So you can kind of see how that's all going to be oriented there. Again, you're probably covering that anatomy, so I won't kind of belabor the points. However, the regulation of GI blood flow is going to be the big things I kind of will focus on right here. So typically what you're going to find, and again, this is kind of one of these microvilli, they're going to be, say, located within, say, the small intestine. Again, it's nice to have all these like little kind of have all these microvilli, because what do they do for us? Yeah, they increase surface area pretty dramatically here. So again, imagine the whole small intestine just being lined with these guys essentially. So typically what you're going to find is the more active areas should probably be receiving more blood flow. Kind of makes sense. Again, they're more active, requiring more ATP to have their contractions and things like that. It's going to be requiring more oxygen. Does that make sense? Now you can have certain areas are going to be things like certain hormones are going to be vasodilators. And again, by having a vasodilator, what does that do to blood flow to those areas? Should typically increase it, which should increase activity, right? So for instance, if I have something like, gastrin, secretin, cholecystokinin, vasoactive intestinal peptide, all these would be vasodilators. You'd expect to see better blood flow coming in. And again, when you have, what's occurring kind of in this area right here? Should be absorption of substances, right? So again, if I were to have, say, like proteins or amino acids or carbohydrates, whatever happens to be, just finding absorption that comes in here, and then it'll get traveling through the venous side, and then where would it go from here? Yeah, the portal vein, like back to the liver, essentially, where you can have some processing that occurs there. So again, that's typically what you're going to find as the general flow. However, if I were to have, say, something like a vasoconstrictor, say sympathetic activation, that's going to be causing constriction here. That does what to the blood flow? Decreases it pretty dramatically, and then that's going to cause it to be less active. And actually, one of the problems you run into, so again, kind of take it back to the tox sort of thing. Has anyone ever heard of like a body packer or a body stuffer? Okay, that's probably a good thing you haven't heard of that. So you imagine, so basically body packers are going to be people that are like kind of drug mules. They're kind of moving drugs from one area of one country to another, essentially. Body stuffers are usually people who are like kind of dealing drugs on the street, and then they see red and blue lights and they say, oh no, I got to get rid of these drugs. And what do they do with them? They swallow them, right? So again, they take them to the GI tract. So for certain drugs, can be a big deal, right? So for instance, if I take a very potent vasoconstrictor and I were to swallow that, and again, are they like very good about wrapping up all their drugs and securing it and making sure it doesn't open up in the GI tract? They're usually pretty scared, and they're going to do whatever they can to get rid of that stuff. So imagine I have someone who's selling crack cocaine on the street. They go ahead and they swallow a couple rocks. It's going to go down their GI tract, and then cocaine, anyone know if it's a vasodilator or constrictor? Actually, a very potent vasoconstrictor. So what you're going to find with cocaine, again, typically you find patients' blood pressure goes up pretty dramatically when they're taking cocaine. That's one of the big things you see. Anyway, causes vasoconstriction. So imagine I have all this cocaine that's now being absorbed by the GI tract right here locally, causing all this constriction here. What do you think happens to that blood flow? It goes down dramatically. And so again, if you starve all this tissue here of all this oxygen, what happens? It's going to start to die off. You're going to see necrosis actually happen there. So you can, what happens is called mesenteric ischemia. So if you have someone who, say, swallowed a couple of crack rocks, and all of a sudden you see their blood pressure start to spike up and go, oh, I know they're absorbing it. That's a big medical emergency. We'd sometimes have to go in, the surgeon has to go in, open them up, and try to get rid of any of the drug product and make sure they don't cause all this necrosis. Because again, what lives in your GI tract? A lot of bacteria. And again, if I have all this bacteria, after all this dead tissue, and they start to try to translocate into the bloodstream, what happens? They'll die of a big old infection, right? So again, that's it's not good typically. We want to make sure we keep all those bacteria right in the GI tract where they should be. So again, that's clinically one of the things we run into occasionally. And in fact, if you ever go down to, I had one guy that worked out of Miami for a number of years, and he said at the Miami airport, they actually had a whole area set up for these drug mules to be coming in. Typically, like drug mules, they have their stuff really well packed for the most part, because again, if you lose your drug, you lose your money essentially. And so they would have these people that just have their whole GI tract just full of these, really well packed, like wax sealed things of cocaine or heroin, whatever it happened to be. And they would actually have commodes there that were set up where they'd actually give them a laxative essentially that would force them to just defecate out all these things, and they would be able to collect the drugs in a little sifter, and then they send them to jail essentially. But they had to have it there in the airport because it was so frequently they were running those patients there, those body packers. Anyway, enough digression. But basically, sympathetic activation decreases GI blood flow. That was basically all that tangent was trying to get at. Start off, we can talk about the mouth briefly. Anyone know what that is? The Sarlacc Pit, for those of you who don't know, again. Anyone know who got swallowed up by the Sarlacc Pit? Boba Fett, thank you so much. Someone knew that. Anyway. Okay, so looking at, actually that's not what a real mouth looks like, if you guys were confused. This is, yes, Star Wars reference. People mostly see my R2-D2, so they know what's up. Anyway, so first off, starting with teeth, what are teeth good for? Chewing, biting, ripping things apart essentially, right? So again, boy, I tell you what, when your infant starts to develop teeth, you gotta be careful, because they hurt. Anyway, incisors are good for biting, cutting food. Canines are good for tearing it. Premolars good for crushing, and then finally the molars, usually the largest teeth, good for crushing and grinding food. Right? Again, usually want to take good care of these, because once you lose your permanent set, you got to get dentures. Those are no good. Next one, mastication. What's the function of mastication? And that seems basic, but again, we're going to get into more detailed stuff. You can just start to break down the food, smaller particles, because again, you want to be able to get small enough particles to go down the esophagus without really kind of any issues here. It's also going to start mixing with saliva. Saliva coming from salivary glands, good. And so you're going to find that there's lots of different cranial nerves that are responsible for helping to coordinate all of this. So for instance, looking at the muscles of mastication, you're going to see here like the trigeminal nerve is going to be the big innervator here. Also, cranial nerve 7 is going to be involved here as well, as making sure we're kind of coordinating our mastication. So again, one of the things you're going to find, there's actually a chewing reflex that occurs here. So again, having food bolus in the mouth actually starts to initiate this kind of reflex that happens here. So for instance, you'll do things like lower the jaw. Lower jaw is going to initiate a stretch reflex, and so usually it's a rebound sort of contraction that happens there. It's going to have to close the teeth, compress it against the mouth linings, and you start to see some of that crushing of the food actually occurs there. Again, you're going to repeat that hopefully you repeat the process, otherwise you don't just swallow a whole, and that's no good. But hopefully you're trying to get small enough food particles. Not only does that make it easier to swallow, what does that do to the surface area of the food? Increases it pretty significantly, and that allows for easier breakdown with enzymes, allows it for easier mixing, allows it for easier ability to be absorbed in those cases, right? So more surface area, more room for enzymes to work. Also prevents kind of damage done to the GI tract. And also, things like, more insoluble sort of particles, you can break those down, start to release some of their nutrients and whatnot. That can also be a useful product of mastication as well. Again, saliva, primary secretions, you're going to see things like, ptyalin here is going to be helping to digest starches. Mucus secretions are going to have this mucin, is good for lubricating the food to allow for easy absorption or travel down the esophagus there. The main glands we're going to focus on are going to be the parotid gland and primary kind of serous secretion here. And then the submandibular and sublingual are going to be better for serous and mucus secretions, right? So those are good for kind of lubrication of the food there. And then we have some tiny buccal glands. Those are mostly going to be mucus sort of secretions. And then typically you're secreting around 800 to 1500 mLs per day. Again, you don't lose all that fluid. Again, you reabsorb that through the GI tract as well. So again, it's usually going to be kind of a net balance there as far as volume goes. Okay. Anyway, just looking at the function of saliva, it's also good to help prevent kind of buildup of bacteria, because of course bacteria start to build up, so we can see that things like cavities start to develop. So saliva helps to kind of wash away bacteria, wash away food particles, and there's also some things like proteolytic enzymes and things like that. Actually, some antibodies as well. Anyone remember antibodies in saliva? Yeah, IgA is primarily there. That can also help with some of those bacteria as well. So kind of getting rid of those, so that way we can keep our teeth nice and clean. And again, looking at innervation here, again, remember that the sublingual submandibular are going to be innervated by cranial nerve number 7. The product gland is going to be number 9. We talked about this previously when we were talking about the senses, so I don't want to belabor this. Just remember we also have like our taste sensors there. And they're also going to find some stimulation done by the reflex from the stomach and the upper small intestines that can also help to stimulate product glands or the salivary glands to secrete as well. Okay, so I'm going to go ahead and let you guys know go now. Any questions I can answer before you leave? All right, so we'll cover the rest of the GI tract, and then we'll go on from there. All right, thanks.